help those without internet service register for a vaccine. So with that, we have Westmead Baptist Church. Registration helpline number is 256. That's 584-7080, and their hours of operation Monday through Thursday, 8 a.m. to 4 p.m. And then we have the Rotary Club of Decatur. The helpline number there is 256-303-1123, 303-1123, and that's Monday through Friday, 8 a.m. to 5 p.m. Today we are pleased to have with us Decatur Morgan Hospital Chief Nursing Officer Anita Walden. Hey, it's good to have you back.
Good to be here.
And then of course our good friend Judy Smith with Alabama Department of Health. Judy, it's nice to have you with us. So just a quick update. As of yesterday we had 11,809 confirmed cases, another 2,362 probable cases, which brings us just slightly over 14,000 cases here in Morgan County. Our 14-day percent positive rate is now 2.99%, and boy, that'll sure make you smile. So, again, keep doing what you're doing. I'm hearing, and I know I'm going to get a report from you, so I'll just button up and let you shoot. Let's do that. So, Anita, if you will you give us an update from the hospital? Thank you.
Sure. Today we have 5 positive patients at the hospital, 1 in ICU, no vents. We don't have any positive employees. That's a first in a long, long time. We have vaccinated 20,849 so far at the hospital. And we got a little bit of help at the beginning with our employees because we didn't have our vaccine yet from Athens, so you could probably add another 400 and something to that number. System-wide, Huntsville Hospital system-wide, we've vaccinated 147,000, just a little over that. We are seeing a little bit of an uptick in our cases, especially in Madison County, not so much here yet. But, you know, thinking of that, I just want to caution everybody again, please don't let down your guard. We've had Easter, we've had spring break, we've had people, you know, not wearing their mask. I was out and about this weekend. I saw a lot of people without a mask. That's a little worrisome because they didn't have one of these on that says I've been vaccinated. So makes me nervous. Please get your vaccination. As a reminder, we have Pfizer vaccine, and all Alabamians 16 and greater are eligible now. You can call us at 256-973-2888. That's 973-2888 for an appointment, or you can sign up on the DecaturMorgan.net website. Our clinic is located at the Parkway Clinic and our Parkway campus. Easy access, surface parking, walk right in. Our hours are Monday through Thursday, 8 till 4, and on Friday, 8 till noon. If you call us before noon, we can usually get you in the same day, but we can definitely get you in within 24 hours. If you've had an anaphylactic reaction of any kind, that's including IV contrast or reactions to any other vaccines, you'll need to bring written approval from a physician to be vaccinated. We observe you for 15 minutes after you get the vaccine, and if you've had any kind of allergic reaction, we will observe you for 30 minutes. I am allergic to penicillin, so I was observed for 30 minutes, had absolutely no issue. I can tell you that of all the people that we have vaccinated, we've had very few reactions. Only, you know, a few that's been truly anaphylactic. The rest we've just watched, and they've been okay. So we will take good care of you. We have everything that we need to take care of you. And at the Parkway Clinic, if you're really nervous, we've got an ER right there. So we'll be glad to have you and encourage you again to please, please get your vaccination and wear your mask.
So I've heard from quite a few residents who have gone to the Parkway campus, and they just go on and on about how efficient the process is and smooth.
It is.
Yeah.
We've seen a lot of people bragging about us on Google, and we've had many calls, and the process is like clockwork. So
Good.
it's easy.
Well done.
Sure.
All right, Ms. Judy, I'm sure your process is just as smooth.
Well, I certainly hope so. And Mayor, I'll have to tell you up front, I think Anita's stolen all my thunder, so
I'm
that's fine.
sorry. I'm so
that's all
sorry.
right. So it'll be a short thing. You know, it is wonderful though to be able to come and talk about the good news we have, because we've been a year plus in talking about a lot of news that hasn't been so good. So things are better, and you are correct. The less than 3% positivity rate is very promising. I will say that less people are getting tested, and I hope that that's not part of the, and I'm sure it's a little bit of the positivity rate, but hopefully it's not, you know, all bad. Anita told you what the hospital had done in terms of vaccination. In this county, there have been 53,656 doses of vaccine given to folks in this county. 32,847 folks have received a first dose, and some over 23,000 have received both doses. So we are definitely aiming in the right direction, you know, if we can just keep going there. I will tell you up front that about a fourth of those, of all the age groups, about a fourth of them are less than 55. A fourth of them 55 to 64, a fourth 65 to 75, and then the final 25%. So it's pretty evenly divided in terms of the groups that have gotten it. I will say this, more women have gotten it than men. And it's just because y'all are chicken, and you know, and we just don't tell you about the clinic, because if you go, you get, I'm kidding. But at any rate, we do need to have folks vaccinated. We really and truly do. It is the best hope we've got. And as Anita said, you know, we are seeing the numbers climb up a little bit. For those of us in the healthcare arena, that's always concerning. You know, and last week was a tough week because, first of all, we had the Johnson & Johnson hiccup. And I do want to say that I truly believe it is a hiccup. It's not a long-term thing. But, you know, let me initially say, it was a very appropriate reaction to have paused the Johnson & Johnson until we knew what was going on. Now, that being said, I think we need to applaud our CDC and our medical resource folks, because to pick up on 6 to 7 instances out of almost 7 million doses of Johnson & Johnson that were given, you know, that is tremendous. And I'm sure that Anita and her crew, and certainly our crew, we submit stuff to CDC anytime anybody has anything that's even indifferent. Then we send it, you know, to CDC. So for them to have picked up on that so quickly and to have done what they did, I certainly don't need to say this, but it is my belief it is a pause. It's not a stop. I will say that many years ago, and it was many years ago when I was a young nurse, I remember we used to give aspirin to young children to bring their fever down. And then after a period of time, we realized something was going on neurologically, and we learned that aspirin was not the best medicine to give to young children. There was a neurological syndrome that happened, and so we stopped it. So this is not per se unusual. It is correct. It is the appropriate thing to do, but it's not really unusual. And for all of you who watch TV, you know, anytime you're on, we're always advertising medicine, and we're always saying, but if you have stomachache, or if you have this, or if you've ever had TB, or you call your doctor. Well, we're in that same sort of boat. But when we go back to the numbers that you all have already given, you know, we've had in the world, we've had 3 million people to die of COVID. In the United States, we've had 567,000 people who have died. In Alabama, we are just under 11,000 people who have died of COVID. And then, as you said, in Morgan County, we have 273. And actually, we happen to know that, unfortunately, another person will be added to our numbers by tomorrow. So, you know, everybody has to weigh their options. Everybody needs to really think about what they need to do, but it needs to be an informed decision. And I will say that Dr. Google and Dr. Facebook are not the places that you need to look to for your information, for your scientific information. And so, you know, weigh the fact. I mean, it is tragic that the lady died, that the young lady died. It is tragic that the other folks had the conditions that they did. And they, you know, there may be a group that we identify that we say, hey, this group doesn't need to get Johnson & Johnson. But when we gave 71,000 doses of Johnson & Johnson in this state before the halt was done, and we've had no incidences like that, that's 71,000 people that got protection against severe illness or hospitalization, that won't have to go spend a weekend with Anita at the hospital or some other hospital. And we think that's a good thing. So make an informed decision, do your own research, get the true information that you need. And again, it's not Dr. Google and it's not Dr. Facebook. Please don't use those. Stay with the scientists. Do what you need to do, the research that you need to do. And again, weigh your options. Please do as Anita said. We don't need to go back any further. Sometimes we we seem like our children, that we tell them over and over and over again what they need to do. And as soon as we turn our heads, they go do something different, and we don't need to go back again. I mean, I feel like, I don't know whether you remember or not, the little game at the fair, you know, where you roll the balls and you do, and the little horse goes forward and your horse gets ahead of my horse. Sometimes we kind of feel like we're doing that. You know, you roll the ball and it goes up there, and, you know, you're getting ahead on the vaccine, and then all of a sudden you got the variances that come along, and then you got the other things. And so, you know, it's not over. We don't know what the variances are going to do. We don't know what the long range of the vaccine is going to do. We don't know what right now it's very promising that Moderna and Pfizer are both looking like that people continue to have antibodies as much as 6 months later. If I were using my crystal ball, I would say at some time we will end up giving boosters. I know that Moderna actually is working on a process of having a combined COVID and flu vaccine, which I think will be cool for those of us who choose to do that. So, you know, we've still got a long way to go. Please don't give up just because things are so much better. And it was a wonderful weekend. Most people got out. It was beautiful. Please be careful about what you do. And why are we still wearing masks? We're still wearing masks because 2 people in my church reported yesterday that they have cancer, and they're going to begin cancer treatment. We live in a world where immunity suppression is there for people who have diseases, for people who've had transplants, for lots of reasons. We know that, again, I'll just use the Johnson & Johnson, we know that all of the vaccines predominantly prevent severe disease and hospitalization, but they don't necessarily prevent everything. You know, even those of us who take a flu shot every year, we know that it may not totally keep us from having the flu, but it keeps us from having the bad flu. It makes it a lot better. This vaccine will probably end up being the same way. We don't know that we can't shed virus to other people who are far less immune than we are. The jury's still out in terms of what the long-range effect is going to be. We definitely don't need to go backwards. So we don't know what the variances are going to do, and we still have a lot of folks that are under 16 that have not been vaccinated. And I think Anita would probably agree with me. We think it's kind of, we kind of weigh it. We've got groups on one side that will come up and lie about their ages because they are so afraid and they want the vaccine so bad. Then you've got groups on the other side that I think kicking and pulling, you would never get them into. Please just make an informed decision. Please see what you know, do what not going to make this weekend. We need to keep going forward to where we need to go. So thank you, Mayor. Thank you for the opportunity to be here.
And Anita, I mean, we've been together. I can't recall how long we've been doing these press conferences. but to see the
A
numbers.
long
Too
time.
long, and a lot of sadness.
Yes.
You know, it's
Yes.
been a roller coaster ride for sure, but things are looking better. I thrilled. Whenever I took the Johnson & Johnson, I had no symptomatic, no issues whatsoever. The day of, the day after, and and the same would apply to my wife and daughter and
Right.
others. So very
Well,
fortunate.
and there are so many people that the Johnson & Johnson would be so beneficial for. And I will have to share with you that right before the pause came on, we had a couple of industries where it's just very difficult to get people back for a second dose. We also had some plans for homebound people, and it's very hard. It's very difficult. It's very resource demanding to take individuals and go out to people that literally can't get out of their home. Our homeless individuals, you know, to find them again for a second dose is very hard. So I will tell you that we were somewhat crushed, you know, I mean, certainly we wanted to do the right thing, but we were somewhat crushed when the pause was put on there. I do believe that after a period of time, there will be indications of who it should be given to and who it shouldn't be given to. Again, just like any other medicine, just like aspirin, just like anything else. And that we'll be able to go forward, because those are still the folks that need to have the vaccine, and we just have to reach out a little further to do so. I think I said it one time, you know, had we had the J&J to start off with, of all those folks that we talked about a minute ago, we would now have 70, almost 100,000 people that had been vaccinated. And this has pulled us in a little bit. It's not stopped us. I failed to say something. I do want to mention that vaccines, when we were talking back in December, you know, I was waiting for people to beat me up because I couldn't get a vaccine. January, I said, if you'll just hang on, we'll get you a vaccine, just hang on. Well, we've got you a vaccine, don't we, Anita?
Yes, we do.
And quite honestly, there's enough vaccine for anybody that wants it. And I can promise you that Parkway will make it available, Decatur Morgan, we will make it available. We are not being strict about appointments at all, at least at our health department. Anita just said that they could probably get you in the same day. So there is no reason that somebody who wants the vaccine, who is the correct age, cannot get it. Now, if you're 16 and 17 years old, you're going to have to get the Pfizer, and that's being given by Decatur Morgan and Payless and a few other pharmacies. Most of the rest of us are given Moderna right now. And so anybody 18 and older can pretty much go anywhere they want to. If you're 16 or 17, you need to go to the hospital or to Payless or one of the folks with Pfizer. So
I did fail to mention that we have contacted all of the area industry, and every day we're going out to a different industry and giving those vaccines. And I apologize, I could have brought those numbers with me, but I just didn't. So, and it's requiring, you know, 2 visits to them.
yeah.
But we're glad to do that. The other thing we're doing is going out to churches. And so we need help in our Hispanic and our Black communities. We want to help them get the vaccine. More than that, I think we need to answer their questions. There's fear, and we need to break that barrier. So if there's questions, don't hesitate to call us. And if whoever answers the phone don't have the answer, we will get the answer to you. We will, you know, provide information out there.
Thank you for going the extra step. We've received a lot of feedback from our industry partners about what I'll call the road show,
Yeah,
where y'all are taking it on the road and actually
it has been
vaccinating.
so much fun. We've just enjoyed it. We've met some really, really nice folks, and they've all been very appreciative of us coming. The other thing to look for is our mobile medical unit will be ready. It's supposed to be ready at the end of this month. So knock on wood, we hope to have it, and it will truly be a traveling show.
Good.
We plan to take it and use it for the effort to get the vaccines out.
So maybe you're watching and you wonder about, boy, I go to the hospital, I'm reluctant to go to the hospital because I'm going to walk in or to the health department, and they're just going to give you a vaccination. That's not the way it works. There's a questionnaire that you complete.
Yes.
So they get some information, and their healthcare professionals that will administer the vaccination, but they won't do it unless you've met the right criteria that's
Right.
on the
We want-
questionnaire.
We want you to be safe,
That's right. Yeah.
absolutely.
And Mayor, it's a very simple questionnaire. I mean, it really is very simple.
Yeah.
The biggest thing is I will tell you that we do not want to, at the health department, give vaccines to folks who've had anaphylactic reactions. You need to be in a medical facility. And we refer those, and Decatur Morgan has been wonderful about taking those folks. We don't want you to have had another vaccine within 14 days, within 2 weeks. So if you've had your shingle shot, we want you to wait 2 weeks before you get it. There are a few procedures that CDC does recommend, that you either get it early or you postpone the vaccine for getting it. But for the most part, it's very simple. Have you ever really had a serious reaction to a medication? Have you had a vaccine? Have you been around anybody with COVID in the last 2 weeks? Or do you have any symptoms right now? And, there are people that will take it after they have symptoms. It's not going to stop you from having the COVID once you've already got it in process. So, but Anita, I want to thank, on behalf of public health, I want to thank Decatur Morgan for all that you all have done. I want to thank our private pharmacies and our other providers, because they also have stepped up to the plate and done. And I will say, it takes a village. It truly takes a village. It may take a village to raise a child, but it also takes a village to get past the pandemic. So my personal belief is, I don't think any of us could have done it by ourselves. I think it took the whole group.
So today's the 19th. I took it on the 1st, so I should be protected.
Should be.
Yeah.
And I'd like to mention, he didn't grow horns. I just want you to know.
But, however, I'm still masking. I'm still distancing.
Yes.
I could improve on my sanitizing. I don't wash my hands quite like I should.
That's a man thing.
Yeah, I could do a better job. So with that, thank y'all so much. Do we have any questions?
I don't have any questions. I think that really the only thing I wanted you guys to touch on, obviously, like you just mentioned, it's not over, but I mean, we have been doing this for a year, and I think it's kind of unbelievable, even compared to a couple months back, the results now. So obviously for the healthcare workers, it's been a journey. So do you just want to touch on kind of what this means to you guys, the unbelievable transformation?
We feel like we are getting a breath finally. The healthcare staff have had a really, really rough year, the roughest that I can remember in my 34-year career. And I think that I don't want anybody to forget what they've been through. They saw too much death. They saw too many people struggling. And it took a toll. It's taken a real toll on healthcare. But we're going to be okay. They are recovering quite nicely. But we are doing all we can to take care of them, and make them feel as special as we possibly can. I want to remind everybody that Nurses Week is coming up. I am in no way leaving out any part of healthcare, because every single person involved has been important. But nurses make up, and nursing staff make up over half of the employees at the hospital. So our physicians have done a wonderful thing. They bought every nurse and nursing assistant a little gift for that week, and I think that's awesome. And we've just gotten so much thanks from our community. So we feel pretty loved, and we appreciate that. So thanks to everybody. Thanks to the health department. Wow. I think we've talked more in the last year than we've talked in all this time. So it does take all of us to get through it. So.
Miss Amy?
No questions here.
All right. Well, look, thank you for joining us today. Let's remember to be kind. We'll have a little adjustment here in our press conferences, and so we'll be moving to the first Monday of each month. And so we'll see you, this time it'll be a little sooner, May the 3rd at 10 o'clock. Until then, we'll see you. Take care. Be safe.
Thank you, sir.
Thank
Good
you.
job, Anita.
Thank
Good job.
you.
It is.